Next, for number 29, which of the following is a gram-positive bacilli most frequently associated as an occupational disease of butchers? Pa-highlight naman po ng butchers. Okay, is it A. Bacillus cereus, B. Bacillus subtilis, C. Erysipelathrix, Ruchopathiae, or D. Listeria monocytogenes? Again, butchers causes butcher's disease. Correct answer po is letter C po. Erysipelathrix Ruchopathiae po. Now, occupational disease of butchers, meat processors, peddlers, farmers, poultry workers, handlers po, and veterinarians po is Erysipelathrix Ruchopathiae po. Bacillus cereus causes the fried rice poisoning. Bacillus subtilis po is the most common lab contaminant. Listeria monocytogenes. Okay, Listeria monocytogenes naman po causes stillbirth. Okay, granulomatosis cystica. Next, for number 30. Number 30, what is the purpose of potassium permanganate when staining acid-fast bacilli with truant auramine rhodamine stain? Again, what is the purpose of potassium permanganate when staining acid-fast bacilli with truant auramine rhodamine stain? Is it letter A, decolorizing agent, letter B, dye, letter C, mordant, or letter D, quenching agent po? For number 30, answer is letter D, quenching agent. Now remember, the counter stain naman po acts as a quenching agent and reduces the background fluorescence of cellular debris po. As an alternative to acid-fast staining po, a fluorescent staining procedure may be used, and the fluorochrome or auramine, specifically the auramine fluorochrome, okay, produces a bright yellow fluorescent mycobacteria po. And the auramine rhodamine naman po serves to produce an orange-red fluorescence against a dark background po. Number 30 po, we have letter. Next, 31. Which of the following mycobacterium produces an orange pigment and is most commonly recovered from water? Again, which of the following mycobacterium produces an orange pigment and is most commonly recovered from water? Choice letter A. Is it M. intracellular? B. Is it M. gordonii? C. Is it M. asiaticum? Or letter D. Is it M. kansasii? Again, which of the following mycobacterium produces an orange pigment and is most commonly recovered from water po? Pahilit naman po ng orange pigment. Correct answer is letter B, M. gordonii po. So, Mycobacterium gordonii has been recovered from water stills, faucets, okay, and bodies of water. So, tap water po, kaya tinatawag po siyang tap water bacilli po. Which is why it's called the tap water scotochromogen. Now, these organisms are not considered to be pathogenic for humans, but because they may be recovered as contaminants, but their identification is recommended. Now, M. gordonii is a common tap water scotochromogen that produces a yellow pigmentation in the dark. And it turns a deeper yellow po with an orange tinge after 2 weeks of light exposure. So, characteristics po ng M. gordonii, nitrate reduction negative, twin hydrolysis positive, and urease negative po. Now, M. kansasii, on the other hand, is a photochromogen producing a yellow pigment following exposure to light, and also it produces red beta-carotene crystals. Again, M. kansasii produces red beta-carotene crystals after long incubation periods. Now, biochemically, M. scrofulaceum is identical to M. gordonii, except po sa urease reaction. Again, ang difference po ni M. gordonii, pati ni M. scrofulaceum is yung urease reaction. Bakit? Dahil si M. scrofulaceum po ay urease positive, and si M. gordonii naman po ay urease negative po. Next, for number 32, which of the following genera requires long-chain fatty acids? Again, which of the following genera requires long-chain fatty acids? Anong answer po natin? Choices. Pilot po ng long-chain fatty acids. Is it A. Klebsiella, B. Neisseria, C. Pseudomonas, or D. Treponema? Again, for number 32, we have letter D. Treponema po. So, spirochetes can use carbohydrates, amino acids, long-chain fatty acids, or long-chain fatty alcohols as carbon and energy sources po. Which of the following causes walking pneumonia? Choices. Is it letter A. Klebsiella pneumoniae, B. Mycobacterium tuberculosis, C. Mycoplasma pneumoniae, letter D. Streptococcus pneumoniae? Answer po natin is Mycoplasma pneumoniae po. Next, for number 34. So, antibiotic inappropriate for K. pneumoniae tested positive for the modified Hodge test. Pahighlight po ng modified Hodge test. Ano kayang antibiotic? Okay, nagtitest positive for the modified Hodge test. Choices, is it letter A. Tobramycin, B. Is it gentamicin, C. Imipenem, or D. Tetracycline? For number 34 po, ano po yung answer natin? Okay, letter C. Imipenem po. Again, letter C. Imipenem. So remember, okay, a modified Hodge test is a simple phenotypic test for the detection of presence of carbapenemase enzyme. Again, carbapenemase enzyme in the bacteria po. So yung positive MHT test po, or modified Hodge test, is observed in, for example, in K. pneumoniae and Serratia marcescens po. With the Klebsiella pneumoniae, carbapenemase or KPC, metallo-beta-lactamase, and the SME1 or Serratia marcescens 1 po. Now, positive, okay, result indicates carbapenemase production by the test microorganism, where the positive result can be seen as, kung makikita niyo po sa picture, clover leaf-like indentation of the E. coli growing along the test organism within the disc diffusion zone. Again, modified Hodge test has been suggested as screening test for carbapenemases po. So, example po ng mga carbapenems that includes imipenem, meropenem, ertapenem, and doripenem po. Next, 35. The yeast form of which dimorphic fungus appears as oval or elongated cigar shapes. Again, the yeast form of which dimorphic fungus appears as oval or elongated cigar shapes. Is it A. Coccidioides immitis, B. Sporothrix schenki, C. Histoplasma capsulatum, or D. Blastomyces dermatitidis po? Okay, so highlight po ng cigar shapes, we have letter B. Sporothrix schenki po. Now, S. schenki is usually acquired by humans through thorns or splinters po, because it is commonly found on living or dead vegetation po. Okay, siya pa yung nagkakos ng rose gardener's disease because gardeners, florists, and farmers are most often yung na-infect nito. S. schenki is also often recovered from exudates of unopened nodules po, subcutaneous nodules or open draining lesions. So, lahat po ng choices na yan, all of them, C. immitis, Histoplasma capsulatum, and B. dermatitidis, they're all thermally dimorphic fungi. That means they can exist in two temperatures. So, S. schenki po, when microscopically examining growth cultures at 37 degrees Celsius, it will reveal small cigar-shaped yeast po. Again, small cigar-shaped yeast. Pero yung mold form po, or yung mold face ng S. schenki reveals a rosette pattern. Next, for number 36, culture media must contain lipids, usually olive oil. Again, pilot po ng olive oil. Sino po yung olive oil-loving fungi sa kanila? Is it letter A. Malassezia furfur, B. Microsporum canis, C. Pedreia hortae, or D. Trichosporon bigeli po? Again, loving fungi. We have letter A. Malassezia furfur po. Microscopically, this yeast po appears round at one end with a bud-like structure on a broad base po at the other end. So, its growth po, again, malassezia for first growth, is enhanced around the olive oil saturated disc. Hence, tawag po sa kanya is olive oil loving fungi po. For number 3, next 37, a dermatophyte that forms antler-like branching hyphae called favic chandeliers. Again, a dermatophyte that forms antler-like branching hyphae called favic chandeliers. Is the letter A, Microsporum gypsum, or B, Microsporum canis, C, Trichophyton schwenleini, or D, Epidermophyton flocosum. Again, pa-highlight naman po ng antler-like or favic chandeliers. Is it M, gypsum, M, canis, C, Trichophyton schwenleini, or D, E, flocosum po? As you can see sa picture, the correct answer po is letter C, Trichophyton schwenleini po. So, just the basics of mycology, right? Sino yung may spiral hyphae? That's Trichophyton mentagrophytes. Sino yung may pectinate body? Pectinate bodies, we have Microsporum oduini po. Yung may favic chandeliers or antler hyphae, we have Trichophyton schwenleini po. Those with nodular organ, we have M. canis, and yung may racket hyphae po, thin, smooth, thin-walled macroconidea po, we have Epidermophyton flocosum. Next, for number 38, rotavirus is present in large number in, again, rotavirus is present in large number in. Is it letter A, CSF, letter B, sputum, C, letter C, stool, or letter D, urine po? Again, rotavirus po. Ang answer po natin, that's letter C, stool. So, rotavirus belongs to the Rheoviridae group, and it causes gastroenteritis in infants and young children, usually during winter months, but asymptomatic po to sa adults. Most common gastroenteritis causing virus in adults is the Norwalk agent or the norovirus. Next, for number 39. Okay, 39, an organism was isolated from an eye wash of a patient with a corneal infection who had been wearing contact lenses for the past 2 years. What is the name of the causative agent? Pa-highlight naman po ng contact lenses. Ano po yung answer natin? Is it letter A, Acanthamoeba species, B, Entamoeba histolytica, C, Naegleria species, or D, Trichomonas vaginalis? Again, pa-highlight naman po ng contact lenses po. Correct answer po is again, correct answer po is letter A, Acanthamoeba species po. So, frequently, identified Acanthamoeba po causing keratitis po, we have A. castellani, Polyphaga, and A. hatcheti po. Yan, Acanthamoeba. Now, Acanthamoeba keratitis primarily affects otherwise healthy people who wear contact lenses po. Now, keratitis may lead to vision loss with some patients requiring a corneal transplant po. Again, frequently identified Acanthamoeba causing keratitis of A. castellani, Polyphaga, and A. hatcheti po. In 2007, CDC released several public health warnings regarding Acanthamoeba keratitis or eye infections that are associated or have most commonly been traced to the use of contaminated lens care solution po. Now, the CDC said a 7-fold increase po in the risk of developing Acanthamoeba keratitis po associated with the use of contact lenses po. Contact lens care solution, I mean. Okay, so ang nangyari po, okay, this prompted the Abbott Medical Optics to withdraw the solution from the market po. Again, most keratitis po commonly have been traced to the use of contaminated lens care. Next, let's go to number 40. Which of the following exhibit Schaffner's dots and have a true relapse in the life cycle po? Choice letter A, is it P. falciparum and P. ovale? Letter B, is it P. falciparum and P. vivax? Letter C, is it P. malariae and P. ovale? Letter D, is it P. vivax and P. ovale? Again, pa-highlight po ng Schaffner's dots. Okay, correct answer po is letter D. P. vivax and P. ovale. So P. falciparum causes malignant tertian malaria. It has the characteristic Morers and Christopher dots. Si P. vivax naman po causes benign tertian malaria with a characteristic Schaffner's dot. Sa tandaan VS, Vilma Santos. Okay, vivax, Schaffner. We have for P. ovale po, it causes ovale malaria po with a characteristic Schaffner's and James dots. Tatandaan, orange juice. Or you can use the mnemonic O.J. Simpson, OJS, ovale, James, Schaffner's po, dots. And we have P. malariae naman po, it causes quartan malaria po with characteristic Siemens or Zimmerman's dots po. 30. Next, number 41. Schizogony does not usually take place in peripheral blood. Young trophozoites and gametocytes are generally the only stages seen on the peripheral blood smear po. Ano answer natin? Again, schizogony does not usually take place in peripheral blood. Young trophozoites and gametocytes are generally the only stages seen on the peripheral blood smear. We have, is it letter A, P. falciparum, B. P. malariae, C. P. ovale, or D. P. vivax po. For number 41, correct answer po is letter A, P. falciparum. Remember, for all Plasmodium species, so that includes P. ovale, P. malariae, and P. vivax, again, all stages can be found in the peripheral blood, except for P. falciparum. Now, the P. falciparum stages are present in the peripheral blood po, and they are in the ring forms and banana-shaped gametocytes po. Remember, for P. falciparum, it has paroxysms of 48 at 48 hours. And we go also to some common facts. We have Plasmodium knowlesi. Okay, the fifth human parasite, which is normally a long-tailed macaque, normally a parasite, of long-tailed macaques from the Macaca fascicularis. Plasmodium vivax, on the other hand, is the Plasmodium with amoeboid trophozoites. Plasmodium malariae naman po, Plasmodium with band trophozoites. So for malaria, we have the malaria rapid diagnostic test. So that includes histidine-rich protein 2. Histidine-rich protein 2 is a water-soluble protein produced by trophozoites and young gametocytes of P. falciparum. We also have PLDH, or Plasmodium lactate dehydrogenase po. PLDH is produced by both sexual and asexual stages po, and it can distinguish between P. falciparum and non-P. falciparum. And we also have the PLDase, or Plasmodium aldolase. This is an enzyme in the glycolytic pathway expressed by the blood stages of all Plasmodiums. Next, for number 42, which of the following conditions is associated with monocytosis? Again, monocytosis po. Is it letter A, infectious mononucleosis, B, lymphoid malignancies, C, tuberculosis, or D, whooping cough? Pa-highlight po ng monocytosis. Correct answer is letter C, tuberculosis po. Again, monocytosis is seen during certain bacterial infections, especially in TB, subacute bacterial endocarditis, syphilis, and even brucella. The basics, right? For neutrophil, okay, neutrophils are increased in bacterial infections. We know that lymphocytes are increased in viral infections, monocytes in TB, syphilis, and malignancies. Eosinophils are increased in allergies and parasites, and basophils in immediate hypersensitivity. Okay, for number 43. Which of the following inclusions is only visible with supravital staining? Again, which of the following inclusions is only visible with supravital staining? Is it letter A, basophilic stippling, B, Cabot rings, C, Heinz bodies, or D, Pappenheimer bodies? Again, which of the following inclusions is only visible with supravital staining? The correct answer is letter C, Heinz. Okay, now going to the RBC inclusion bodies. We have Heinz bodies. Heinz bodies can be stained using supravital stain, either brilliant cressyl blue or new methylene blue. And remember, Heinz bodies are not seen with the right stain. It cannot be stained with the right stain. Halogen bodies can be seen in can be stained with Wrights and fusions po. Basophilic stipplings can be stained with Wrights and new methylene blue. Pappenheimer bodies, on the other hand, Pappenheimer bodies or siderotic granules or siderocytes can be stained with Wrights or Prussian blue po. And Cabot rings naman po, which are said to be remnants of the mitotic spindle po, can be stained with Wright stain. And also we have parasites po, can be stained with Wright stain po. Next, for number 44, which of the following contain RNA and are usually identified by staining with brilliant crescent blue or new methylene blue? A. Heinz bodies, B. reticulocytes, C. siderotic granules, or D. Howe-Jolly bodies. Again, pa-highlight naman po ng containing RNA stained with brilliant crescent blue or new methylene blue. The correct answer po is letter B. Now again, punta naman po tayo sa nature nila. Okay, for the nature of the inclusion bodies, Howe-Jolly bodies is made up mainly of DNA po. Basophilic stippling is made up of RNA. Now, Pappenheimer bodies, or again, siderocytes, are made up of iron. Heinz bodies naman po are made up of denatured or precipitated hemoglobin. Cabot rings, again, remnants of the mitotic spindle. It forms loops or number 8. And we have parasites naman po composed of parasites, malaria, babesia, for example, and trypanosomes. Next, which of the following clinical conditions is associated with stomatocytes? Is it letter A, beta lipoproteinemia, again stomatocytes po, letter B, alcoholic cirrhosis, letter C, renal insufficiency, or letter D, severe burns? Again, which of the following clinical conditions is associated with stomatocytes? Answer is letter B, alcoholic cirrhosis. So remember, clinical conditions associated with an increase in stomatocytes include, but are not limited to, alcoholism, alcoholic cirrhosis, glutathione deficiency, hereditary spherocytosis, infectious mononucleosis, also have lead poisoning, malignancies po. And these cells can also be seen in hereditary stomatocytosis or Rh null disease po. Remember sa Rh null disease, okay, itong condition na to lacks the Rh antigen complex po. For number 45, letter, just a recap of the poikilocytes. Okay, so acanthocytes can be seen in a beta lipoproteinemia or severe liver disease. Echinocytes or Burr cells can be seen in uremia, even pyruvate kinase deficiency, or it may exist as an artifact due to the alkaline glass effect. Elliptocytes, okay, can be seen in hereditary elliptocytosis, iron deficiency, and thalassemia po. Macroovalocytes can be seen in megaloblastic anemia. We have the helmet cells or keratocytes can be seen in hemolytic processes, and schistocytes or RBC fragmentation. Usually, RBC fragmentation can be due to or can be as a result of infection, trauma, or toxins. Okay, schistocytes can be found in hemolytic processes as well as in disseminated intravascular coagulation or the also have spherocytes. Okay, spherocytes naman po can be seen in hereditary spherocytosis po, can be seen in ABO-HDN and other hemolytic processes po. Now, somatocytes naman, or mouth cell, so pag 50% naman po makikita sa peripheral blood, that is usually indicative of hereditary stomatocytosis, can be seen also in liver disease. Now, for target cell or codocyte, again, target cell or codocyte po, can be seen in liver disease, thalassemia, and other hemoglobinopathies. And lastly, we have teardrop cell or the cryocyte. Can be seen in extramedullary hematopoiesis and thalassemias. And next, Burr cells are increased in which of the following conditions? Is it letter A, beta lipoproteinemia, letter B, microangiopathic hemolytic anemia, C, myelofibrosis, or letter D, uremia? Again, burst cells are increased in which of the following conditions? Is it A-beta lipoproteinemia, microangiopathic hemolytic anemia, myelofibrosis, or uremia? Correct answer po is letter D, uremia po. Burst cells or number 47, red cell inclusions associated with mothball ingestion or naphthalene ball ingestion. Is it letter A, basophilic stipplings, letter B, Heinz bodies, C, Howell-Jolly bodies, or D, Pappenheimer bodies? Again, red cell inclusions associated with mothball ingestion po. Ano ping answer natin? We have letter B, Heinz bodies po. So remember, Howell-Jolly bodies can be seen in disturbed erythropoiesis, hemolytic anemias, megaloblastic anemia, and even post-splenectomy. Basophilic stipplings can be seen in thalassemia and lead poisoning, and Pappenheimer bodies can be seen in sideroblastic anemias and hemoglobinopathies. Again, Pappenheimer bodies can be seen in sideroblastic anemias and hemoglobinopathies. Okay, for number 48. Which of the following conditions is characterized with a decreased haptoglobin concentration? Again, decreased haptoglobin concentration. Is it letter A, acute inflammation, B, chronic inflammation, C, extravascular hemolysis, letter D, intravascular hemolysis? Again, which of the following conditions is characterized with a decreased haptoglobin concentration? Number 48, the answer is letter D, intravascular hemolysis. Now, intravascular hemolysis is characterized with hemoglobinemia, methemoglobinuria, and hemosidenuria. And remember, haptoglobin is decreased. Schistocytes may also be seen on the blood smear during intravascular hemolysis. For extravascular hemolysis, this is macrophage-mediated hemolytic anemia. There is an increased unconjugated bilirubin in the blood plasma and increased urobilinogen in the urine. Again, in extravascular hemolysis, increased po yung unconjugated bilirubin sa plasma po. Increased naman po ang urobilinogen sa urine. And spherocytes may be seen in the... For number 49, which of the following is likely to occur first in iron deficiency anemia? Again, which of the following is likely to occur first in iron deficiency anemia? Is it letter A, decreased serum iron, letter B, increased total iron binding capacity, letter C, decreased serum ferritin, or letter D, increased transferrin? Correct answer is letter C, decreased serum ferritin. So let's go to the development or the stages in the development of iron deficiency anemia or the iron studies. Now for normal iron status po, normal lahat, hemoglobin, serum iron, total iron binding capacity, and ferritin po. So sa iron depletion, we have 3 stages. We have stage 1, the storage iron depletion, stage 2, transport iron depletion, and lastly, stage 3, functional iron depletion. Now kung mapapansin nyo po again, yung first stage po is storage iron depletion po. So, decreased po yung iron storage po, which is ferritin, decreased ferritin. Sa stage 2, we have the transport iron depletion po. Again, stage 2, transport iron depletion. So kung mapapansin nyo po, mababa po of course ang ferritin. And meron ng iron losses po. Again, may iron losses na po. Now, in compensation to this iron loss, total iron binding capacity po ay mag-i-increase po. And lastly, we have stage 3, functional iron depletion. In here, halos lahat ay decrease na, even hemoglobin po. For number 50, storage pool deficiencies are defects of Letter A, platelet adhesion. Letter B, platelet aggregation. Letter C, platelet granules. Or letter D, platelet production. Again, storage pool deficiencies or defects of. Correct answer is letter C, platelet granules. Now, storage pool deficiencies or defects of platelet granules. Most commonly, a decrease in platelet-dense granules is present with decreased release of ADP, calcium, serotonin from platelet-dense granules. Next, for number 51. So, lupus anticoagulants are risk factors for, again, lupus anticoagulant are risk factors for what? Is it letter A, fibrinolysis, B, hemolysis, C, hemorrhage, or letter D, thrombosis? Again, lupus anticoagulants are risk factors for Okay, so correct answer po is letter D, thrombosis po. Now, lupus anticoagulants are autoantibodies produced by the immune system po that mistakenly attacks certain components of the body's own cells. Ang tinatarget po nila specifically ay phospholipids as well as the proteins associated with phospholipids. Now, remember that the presence of lupus anticoagulant in the human body is associated with an increased risk of developing inappropriate blood clots po or tinatawag nating thrombosis. Now, these clots may block blood flow leading to stroke, heart attack, or pulmonary embolism po. Okay, so, initial testing of lupus anticoagulant typically involves one or more tests. Okay, for testing of lupus anticoagulant, we have PTT or partial thromboplastin time. We have LA-sensitive PTT, and we have the dilute Russell-Viper venum test or DR-VVT. So remember, lupus anticoagulants inhibit the chemical reactions that lead to clotting in the partial thromboplastin time. Again, all of these tests measure the time it takes for a plasma sample to clot because it is said that lupus anticoagulant prolongs that time. Now, presently, there are actually 4 criteria for the diagnosis of lupus anticoagulant. Nakalagay po yan sa HAR. First is prolongation po of one or more of the clotting tests, like APDT or the VVT. Like kakasabi ko lang po. And we also have the presence of inhibitor confirmed by mixing studies, usually not corrected po. Third, we have evidence that the inhibitor is directed against the phospholipid by the using the platelet neutralization test. And lastly po, the last criterion po, lack of any other causes for thrombosis. Number 52, oral anticoagulants can reduce the level of, is it letter A, fibrinogen and calcium? Letter B, fibrinogen and factor 5? Letter C, factors 5 and 8? Or letter D, protein C and S? Again, oral anticoagulants can reduce the levels of, correct answer po is letter D, protein C and S. Next, for number 53, which mutation is shared by large percentage of patients with polycythemia vera, essential thrombocythemia, and primary myelofibrosis? Again, which mutation is shared by a large percentage of patients with polycythemia vera, essential thrombocythemia, and primary myelofibrosis? Choices. Is it letter A, BCR, ABL, mutation in the BCR, ABL gene? Letter B, JAK2 V61F. And we have letter C, PDGFR, or letter D, RUNX1 or RUNX1 gene mutation. For number 53, pa-highlight naman po ng polycythemia vera, ET or essential thrombocythemia, and primary myelofibrosis. Correct answer is letter B, JAK2V617F. Again, for PV, ET, and primary myelofibrosis. BCR, ABL mutations naman are associated with CML. For chronic myelogenous leukemia, we have PDGFR naman, mutation. Again, PDGFR gene mutation naman is associated with neoplasms with eosinophilia po. And we also have RUNX1. RUNX1 naman po, gene mutation can be seen in acute leukemia. Next, for number 54, the JAK2 or JAK2 mutation may be positive in all of the following chronic myeloproliferative disorders except. Again, the JAK2 mutation may be positive in all of the following chronic myeloproliferative disorders except. Is it letter A, essential thrombocythemia, letter B, myelofibrosis, letter C, polycythemia vera, or letter D, CML? Again, pa-highlight naman po ng JAK2 mutation po. We have letter D, CML. Again, ang tanong po ay except. Again, except letter D, CML. Kung may gene mutation man po na associated sa kanya, that's BCR, ABL gene mutation. Again, the JAK2 mutation naman po may be positive in patients with myelofibrosis. Around 35 to 37% po. Sa polycythemia vera naman po, 65 to 97%. And for essential thrombocythemia, around 23% to 57%. Okay, for number 55, only 2 ml of blood is collected in a vacuum tube containing EDTA that is designed for 7 ml draw. Which of the following result can be? Again, only 2 ml of blood is collected in a vacuum tube containing EDTA that is designed for 7 ml draw. So, the result would be, so as you can see, 2 ml of blood po nilagay sa vacuum tube, but original that is designed for 7 ml draw. Okay, so that's over anticoagulation or excessive anticoagulant. Choices, anong effect niya? Is it letter A, falsely lowered RBC count, letter B, falsely elevated hemoglobin, or letter C, erroneously decreased hematocrit, or letter D, ESR is of expected value? Correct answer po ay letter C, erroneously decreased hematocrit po. So since excessive anticoagulant causes shrinkage of red cells, the ESR po, pati yung hematocrit po ay affected. Again, pag may over anticoagulation po, affected po ang ESR at ang hematocrit po. Pero yung number ng RBCs or yung dami niya is not altered po. Pati yung hemoglobin na rin. Again and again, over anticoagulation po, okay, causes shrinkage of red cells, ESR and microhematocrit are affected, but the number of RBCs as well as the hemoglobin po ay hindi affected. And note that the calculated hematocrit po determined by electrical impedance instruments does not reflect this morphologic change po. For C. For number 56, a 28-year-old female patient presented to the emergency department with symptoms suggestive of DIC. ACBC and coagulation studies were ordered. Now, the peripheral smear showed blasts and immature cells with heavy granulation in our rods. Which of the following disorders would be most likely? Again, a 28-year-old female patient presented to the emergency department with symptoms suggestive of DIC. Pa-highlight naman po ng suggestive of DIC, blasts and our rods. Now, ano kayang condition? Is it letter A, ANL with translocation 9-11, letter B, ANLL with translocation 15-17, letter C, ALL with translocation 12-21, or letter D, ALL with translocation 9-22? Correct answer is letter B, ANL. Now for number 57, the genetic mutation associated with CML? Again, the genetic mutation associated with CML. Is it letter A, translocation 15-17, letter B, translocation 11-14, or letter C, translocation 9-22, or translocation 8-21? Again, genetic mutation associated with CML, we have letter C, translocation 9-22. So remember, translocation 15-17 is associated with acute promyelocytic leukemia. Again, acute promyelocytic leukemia. And for translocation 8-21, that is associated with acute myeloid leukemia. Okay, for number 58, paroxysmal nocturnal hemoglobinuria is characterized by flow cytometry results that are, again, paroxysmal nocturnal hemoglobinuria is characterized by flow cytometry results that are letter A, negative for CD55 and CD59, letter B, positive for CD55 and CD59, letter C, negative for CD4 and CD8, or letter D, positive for all normal CD markers. Okay, for PNH, correct answer is letter A, negative for CD55 and CD59. Now remember, we have the PIGA or the PIGA gene. Okay, this PIGA gene codes for GPI-anchored proteins. GPI, by the way, stands for glycophosphatidylainositol. Now, PNH shows a mutation in the PIGA gene, which results in deficiencies in these GPI proteins. So, indicated by a negative CD55 and CD. For paroxysmal nocturnal hemoglobinuria, the screening test is sucrose hemolysis test, and the confirmatory test is acid serum test. For number 59, a patient's hemoglobin level is 12.3 grams per DL. The erythrocytes appear normochromic on the right stain smear, the hematocrit value that correlates with this data. Again, the patient's hemoglobin level is 12.3 grams per DL. Erythrocytes appear normochromic. Pahighlight naman po ng normochromic on the right stain smear. Choices, ano yung hematocrit value? Letter A, 0.34, letter B, 0.37, letter C, 0.40, or letter D, 0.43. Okay, correct answer is letter B, 0.37. Okay, 0.37 hematocrit value. Okay, so just in case po nakalimutan niyo yung RBC indices. Okay, so we have three RBC indices. We have MCV, which stands for mean cell volume. We have MCH, okay, mean cell hemoglobin, and we have MCHC po, which stands for mean cell hemoglobin concentration. Now for MCV, or mean cell volume, normal value po is 80 to 100 fetoliter. So how do we solve for MCV? That's hematocrit over RBC times 10. Again, hematocrit over RBC times 10. If it falls within the normal value, which is 80 to 100 fetoliter, we say na yung nature ng RBC is normocytic. Pag less than the normal value, which is less than 80 fetoliter, that's microcytic. And pag more than 100 fetoliter naman po, we say macrocytic. Now for MCH naman, or mean cell hemoglobin, the normal value po is 27 to 31 pg. And how do we solve for MCH? That's hemoglobin over RBC times 10. And for MCHC, the normal value po is 31, or mean cell hemoglobin concentration, normal value is 31 to 36 grams per DL, or 31 to 36%. Now, how to solve for MCHC? That's hemoglobin over hematocrit times 100 po. Okay, if it falls within the normal range of the MCHC, which is 31 to 36, we say normochromic po. Pag less than 31 naman, less than 31 grams per DL, we say hypochromic. And pag greater than 36 grams per DL, we say hyperchromic. Now, in the following question, we were asked to find the hematocrit. Now, since the hemoglobin level po is given, which is 12.3 grams per DL, and since we know that the RBCs are normochromic, that means it falls within the normal range of the MCHC, okay, which is 31 to 36%, or on average, 33%. Okay, we are going to derive from the formula. Now again, to solve for the MCHC, that's hemoglobin over hematocrit times 100. Now to solve for the hematocrit, we come up with the formula, okay, deriving from that, hematocrit is equals to hemoglobin over MCHC. So to solve for that, that's hemoglobin is 12.3, so 12.3 divided by 33%. So the answer po is 37%.